All right, everyone, we're going to go ahead and get started. Welcome to A Healthier You Health Screenings by Age. Before we begin, just a few things. Please keep all questions until the end of the presentation. You can use either the chat box or the Q&A when asking your questions, and I'll be monitoring both places. On behalf of the library and our director, Sai Rao, I'd like to begin by thanking Dr. Carolyn Pert, Nikki Medeiros, and Hackensack Radiant Palisades Medical Center for helping to organize and for volunteering their time at this event tonight. We really do appreciate you guys coming out this evening. I'd like to introduce Dr. Carolyn Pert. Dr. Pert is a board-certified family medicine physician who specializes in seeing patients from birth to adulthood. She attended medical school at Ross University in Dominica, West Indies, and completed her residency at Bronx Care Health System, an affiliate of Mount Sinai School of Medicine. She has a special interest in preventative care for the entire family, women's health, chronic disease care management, and lifestyle medicine. In her spare time, Dr. Pert enjoys volunteering, reading, and traveling. So without further ado, I'll turn things over to Dr. Pert.
Thank you, Chelsea. Thank you for such a warm introduction. Okay, good evening, everyone. We're going to get started. And again, my name is Dr. Peard, and today I'm going to be discussing health screenings by age. So I'm going to start with just discussing the screenings that we do for kids, and then I'm sort of going to move into adults. Most of our time is going to be spent on adults. So as we get started, the first question for kids is, what is the purpose of health screening for kids? And the purpose of health screening for kids is prevention. So our main focus with children is prevention. Your children would get their scheduled immunization to prevent illness. We focus on nutrition. We also focus on safety. We also focus on tracking the growth and development, as well as the child's milestones. We want to make sure that they're developing their social skills, their language skills, as well as their motor skills. We also want to raise concerns. So when you visit your provider, you want to raise concerns and make a list of topics that you would like to talk to your provider about in regards to your child. And this is done with your well child visit. Also want to have a team-based approach where you have regular visits where you're able to create a strong and trustworthy relationship with your provider. So we want to focus on keeping our kids healthy with these regular screenings. So for children from newborn to 1 year old, our infants, they'll have a newborn screening. This screening is normally done in the hospital. So with this screening, we're looking at genetic testing for certain conditions. They'll have a congenital heart disease screening, as well as hearing screening. They'll also have their routine well visits at 1 to 2 weeks, and it will continue on at 1 month, 2 months, 4 months, and so on up until 12 months. And with these screenings or with these visits, we want to include some physical measurements such as their height, their weight, head circumference. And as they get older, we'll check the blood pressure, we'll do some vision and some hearing tests. We'll also do some developmental screenings, and we'll offer our parents some anticipatory guidance. And when we talk about anticipatory guidance, this is just to sort of help the parents understand what's expected in terms of the growth and development. Just sort of preparing them, making sure that their child use a helmet, making sure that they use sunscreen, making sure that they're using like their seat belt. We sort of move into additional testing that we do, such as checking for anemia, A lead test, normally done at 12 months to 24 months, we'll do a lead screening. And also sometimes we might do a screening for tuberculosis, but this is based on a risk assessment that has to be performed. And then in the event that it's positive, then we would follow up. Also of importance is the oral health. Once a child starts getting like their first tooth and so on, we want to focus on some fluoride supplementation as well as some fluoride varnish. As we go along into the early childhood, they're getting their routine well visits, still a little bit frequently at 12 months or 15 months. These still include, like as we mentioned earlier, our physical measurements, our blood pressure, our vision, hearing, developmental screenings. And then the anemia, lead, and so on is going to be based on a risk assessment. We may consider cholesterol, but that's also based on risk assessment, as well as tuberculosis. And we want to continue with our oral health, making sure that they're seeing their dentist at least yearly or twice a year. As we go into the middle childhood, the visits get less frequent. They're now having their visits annually. We're still doing the physical measurements, and we're still doing all the additional testing that we mentioned earlier. But again, these are going to be based on risk. At about 9 to 11 years old, they'll have a one-time cholesterol screening. So for older kids from 11 to 18 years old, we're doing our routine well visits annually. We may check for anemia. In this age range, they can get a cholesterol screen. We continue with TB after completing a risk assessment. And what we mean by a risk assessment is there anyone in the household who may have traveled to an area that has a high TB rate? Did the child travel? Is there any possible exposure anywhere? Your physician will do the assessment and then decide if you need to get evaluated for TB. We also include in this one our sexually transmitted infections. That's something that you would discuss further. Also have to complete a risk assessment, our HIV screen, and then we continue with our oral health, making sure that they're seeing their dentist twice or once per year. And so for more information in terms of, and so this is really just a brief overview for children. Majority of kids are healthy, so most of the time it's gonna be their immunizations as well as just their routine well visits. But for parents who would like more information, you can visit the American Academy of Pediatrics website. You can also visit healthychildren.org, and there you'll find a lot more information in terms of like the screenings for children. So we're sort of going to move into the adults, and this is where we're going to spend a lot of our time. So what is the purpose of health screenings for adults? So the main purpose of health screening for adults is prevention. And so we screen for medical illnesses. We want to assess your risk for future medical problems. We also want to encourage a healthy lifestyle. We want to update vaccinations, and we also want you to get to know your provider in case of an illness. So as you age, your risk for certain disease and health condition changes. Regular checkups and screenings help to catch warning signs early on. The earlier health issues detected, the easier it is to treat. So to keep yourself in top shape, here's a list of medical tests and screenings that you should get throughout your life. So starting with 18 to 39 years old, I'm briefly going to go over this list, and then I'm going to go in depth about a few of them. So the annual screenings include your weight and height annually. Your blood pressure should be done. You want to get an eye exam every 1 to 2 years. If you're diabetic, you want to get a yearly eye exam. You want to have a dental exam at least once or twice per year. You can have a hearing test, but that varies. You want to get your cholesterol checked. You also want to get skin screening for lesions or for suspicious moles. You want to get obesity screening, and we screen all patients with obesity with a body mass index, and we counsel to maintain a healthy body weight. And your body mass index is just a measure of your body fat based on your height and your weight. We also want to do historical illness screening. So if you have a known family history of certain medical conditions, such as heart disease, diabetes, as well as cancer. We want to screen for hepatitis B, especially in persons that's high risk. Most persons who are born outside the United States are recommended to get screened. And then we also want to do a one-time hepatitis B screening for all adults ages 18 to 79 years old. So again, the diabetes screening, that's annually if there are known risk factors. Otherwise, it can be done biannually if your BMI is greater than 25 or there are other lifestyle factor presence. We want to make sure all immunizations are up to date. You get a yearly depression screening. And here are some blood works that may be done annually. These may include your cholesterol, a complete blood count, which looks at your cells. It can tell us if there's infection, if there's any anemia. We also have a basic or a complete metabolic panel. And this one, the complete metabolic panel, can sort of give us information about your liver, your kidneys. It can tell us about all the important minerals in the body, such as the potassium, the sodium. It can even tell us about nutritional status based on one of the proteins that's actually measured as part of this panel. Your provider may also want to do a thyroid panel. Liver enzymes may be checked, as well as sexually transmitted disease test. So let's just talk a little bit about the blood pressure. So you can have it checked at least once every 2 years. If the top number is from 120 to 139, or the bottom number from 80 to 89, you should have it checked annually. But ideally, you're gonna probably get a blood pressure check every time you have a doctor's visit. Now, if the top number is 130 or the bottom number is 80 or greater, you want to schedule an appointment with your provider to just sort of learn how you can reduce your blood pressure. If you have diabetes or heart disease or kidney disease, then you may want to get it checked more frequently. And you can always get blood pressure checked at like health fairs, at pharmacies. You can even visit your provider office and they may be willing to do a blood pressure check for you. So as we move along, we sort of just gonna discuss a little bit about the cholesterol screening. So for women, we start at age 45 if they have no risk factors for heart disease. Age 20 if they have risk factors. And I just sort of want to mention this, that these are the guidelines, but a lot of times your provider is going to sit with you. They're going to take a history, and then they're going to order a lot of these tests based on that information. So you may get a yearly cholesterol screen done. You may even get it a little bit earlier than 45. For men, we start at age 35 for men with no risk factors, and age 20 if they have known risk factors. For both, if diabetes, heart disease, or kidney problem, we may need to monitor more closely, and we may need to order these tests or screen for cholesterol a little bit more frequently. If changes occur in lifestyle, you want to repeat a little sooner, such as if they have some weight gain or if there's some dietary changes. For diabetes screening, if you have blood pressure that's 130/80 or higher, your doctor may test your blood sugar levels for diabetes. If you have a BMI over 25, your doctor may also want to screen you for diabetes. If you have other risk factors for diabetes, such as a first-degree relative or a history of heart disease, then your doctor may also want to screen you. Screening could be done with a blood test that they'll do as part of your annual physical examination. For cardiovascular risk assessment, so for patients who are greater than 20 years, can be done every 3 to 5 years. Your provider will use what's called a CVD, or cardiovascular risk disease calculator. And it sort of gives them a score, sort of gives them like a percentage, and gives them an idea if in 10 years or so on, you would develop some form of heart disease. Major risk factors that are modifiable are diet, smoking, like managing your blood pressure, dyslipidemia, which is like your cholesterol levels, obesity, becoming a little bit more physically active, and if you have diabetes, just making sure that that's properly controlled. So for our patients that's 18 to 39, some immunizations that are recommended are flu vaccine yearly. At or after age 19, you want to get what's called a Tdap, or a tetanus vaccine, if you did not receive one as an adolescent. And then you would get like a booster every 10 years. You want to get 2 doses of the chickenpox vaccine if you have not had chickenpox, or what we call the varicella vaccine. That's only if you've not had chickenpox or you did not get the vaccine at all. Your doctor can always do a blood test, which sort of checks to see if you are immune. We call these the titers. For the measles, mumps, and rubella, you want to get 2 doses if you are not already immune. And again, your doctor can check your titers and tell if you're immune. Your provider may also recommend other immunizations based on certain conditions. Those ages 19 to 26, you want to ask your provider about the HPV vaccine if you have not received the vaccine in the past or have not completed the series. And this is one of the vaccines that help to prevent cervical cancer. We also have infectious disease screenings, and these screenings you'll normally get annually, but you also want to, again, discuss with your physician, and they'll complete a risk assessment and also determine if you need to get these screenings. So these are chlamydia and gonorrhea. A yearly HIV screen is recommended by CDC. And again, adults should get a one-time test for the hepatitis C. Depending on your lifestyle, you may be screened for syphilis as well as other infections. During your exam, your provider may also ask about depression, and they may complete an assessment utilizing a tool called a PHQ-9. They may discuss their diet and exercise and make recommendations. They may ask about alcohol and tobacco use. And they'll also always discuss safety issues, such as making sure that you use a seat belt, making sure you have smoke detectors, making sure that you have carbon monoxide detectors. And again, these are all preventative measures that we take to just make sure that you're in the best health possible. So skin exam. Your provider may check your skin for signs of skin cancer if you're at high risk. And people at high risk includes those who have had cancer before or have a close relatives with cancer, those who are fair skinned, or those who spend a lot of time outside in the sun. Also, those who have weakened immune system also has a risk for skin cancer. So as we continue on, our cervical cancer screening, and this one is particularly for women, starts at age 21, and women ages 21 to 29 should have a Pap test at least every 3 years. Now, women ages 30 to 65, they can have a Pap with a HPV test, and that's every 5 years, or just the Pap test every 3 years. If you've had a total hysterectomy, then you do not need to have Pap smears done. So now we're sort of aging well. We're moving into age 40 to 64. The screenings completed for adults ages 40 to 64 years of age will continue annually based on your medical history. So a lot of the screenings that we mentioned earlier will continue. You'll still get your annual blood work done. You'll still be keeping up with your immunizations at this age. But once you get into the 40s, then we want to start talking about our colon cancer screening. And the age of initiation and frequency of this screening sort of varies. If you have no risk factors, we start at 45 years of age. And this is new. The guidelines used to be that we start at 50 years old, but recently they have lowered it now to 45 years of age. And it's reasonable to stop around age 75 years old. Now, if you're under age 45 and you have a strong family history of colon cancer, or you have polyps, you want to talk to your provider about screening a little bit earlier. Screening may be considered if you have other risk factors like inflammatory bowel disease, such as Crohn's. So if you had a sibling that had colon cancer at like 45 years old, your provider may want to start screening you 10 years earlier at 35 years old. Also, if you're screened and your provider saw that there were certain abnormalities, like polyps were found, your provider may tell you you need to come, you need to get your screening every 3 years or every 5 years. Now, if you got screened at like 45 and everything is normal, then the screening is normally every 10 years. So we have some extra screenings for women. Again, our annual blood work. We continue annual exams as established earlier, but now we sort of move into the breast cancer screening. This is when we're talking about our mammogram. So the mammogram can start at age 40. You want to discuss with your provider, and you can have them annually or biannually based on your risk factors. So I sort of want to talk a little bit about the breast cancer screening. So women may do a monthly breast self-exam. However, experts do not agree about the benefits of the breast self-exams in finding breast cancer or saving lives. So that's one that I would recommend just talking to your provider about it, so that you and your provider can decide what is best for you. Your provider may do a clinical breast exam as part of your preventive exam. Women ages 40 to 49 may have a mammogram every 1 to 2 years. Women ages 50 to 75 should have their mammogram also either every 1 to 2 years. And again, that depends on their risk factors. Now, for women who have like a mother or a sister who had breast cancer at a younger age, they should consider yearly mammograms. And they should begin earlier than at the age at which the youngest family member was diagnosed. If you have risk factors for breast cancer, in addition to mammogram, your doctor may recommend for you to get a breast ultrasound or even maybe an MRI scan. And then we talked earlier about our pelvic exam or our cervical cancer screening. So pap smear, again, based on history as well as risk factors. And I just want to mention that some of these screenings sort of repeat as we move through the age groups. So extra screening for men, prostate cancer, this is a shared decision between you and your provider. So normally we recommend around age 50 and up unless there are other risk factors are present. 40 to 45 years old in those at high risk for prostate cancer. That's including if you're African American or those with a family history of prostate cancer, particularly if this relative was diagnosed younger than age 45. So when we talk about shared decision-making for prostate cancer screening, before having a test, you want to talk to your doctor about the pros and cons of having a test. And some questions you may want to ask is, does screening decreases your chances of dying from prostate cancer? Is there any harm from prostate cancer screening, such as side effects from testing or over-treatment? Or whether you have a high risk of prostate cancer than others. The recommendations are against screening for men who are older than 70. But again, that's something that I would always say discuss with your provider so you can both determine what is best for you. And if you choose to be tested, the PSA test, which is a blood test that's used, is repeated over time yearly. Osteoporosis screening. So postmenopausal women who are less than 65 years with risk factors. And when we talk about risk factors, we're talking advanced age, if you've had a previous fracture, if you're on long-term steroid, if you have a parental history of fracture, if you have low body weight, if you're a smoker or excessive alcohol consumption. You want to get screened for osteoporosis. Your doctor may do like a bone mineral density scan or what's called a DEXA scan. And lung cancer screening annually. If you're a past smoker, according to the American Lung Association, adults age 55 years and up can have this screening covered by their insurance. So if you have a 20-pack year smoking history and you currently smoke or have quit within the last 15 years. And then a depression screening is also done. And so this is the mental health assessment. So for those 40 to 64, important immunizations are your yearly flu shot. You want to ask your provider if you should get a vaccine to reduce your risk of pneumonia. So your provider may recommend you get the vaccine to help reduce your risk for pneumonia if you have diabetes. Let's say you have certain heart conditions, or let's say you have certain kidney disease. That's something that you would discuss with the provider, or these are questions that you would ask your provider. You should also get your tetanus vaccine again once as part of your Tdap series. And that's only if you have not previously received it, and then you get your booster every 10 years. So at age 50, you should get your shingles or herpes zoster vaccine at or after age 50. And the shingles normally comes up at an older age, and normally shingles is just chicken pox sort of reappearing at an older age. Your provider may also recommend other immunizations if you are high risk for certain conditions. So when we get to about 65 years old, all the previous yearly tests will continue, but with these additions, we continue with our colon cancer screening up until 65. Now, if you've never had a colon cancer screening, then a baseline test may be done for you and continued tests based on these testing based on these results. Height and weight becomes important in this age group. Although this is a screening that's performed every year, but as you age, your height becomes more important, as shrinking height could also be a sign of osteoporosis. We also want to do a fall prevention screening. So you may come into your doctor's office and they may ask you some questions in regards to if you've had any falls at home, how many falls in the last year. That's sort of to establish a baseline. And then they'll continue this screening as needed. A depression screening may be done. The depression screening may ask questions such as, do you still enjoy the activities that you used to do? So let's say you used to play bingo. Do you still enjoy that activity? Are you able to concentrate? Are you feeling down? Are you feeling restless? And then they'll sort of ask you those questions. They'll come up with a score, and then they'll sort of determine from there if there's no depression, if it's moderate, or if there is a major depression. And then your provider will follow up from there, and they'll make recommendations. In this age, the flu vaccine is important. You'll get a high dose flu vaccine at this age, and this is recommended by the CDC. So some extra screenings for women. At 65, cervical cancer screening or the pap smears can stop. And again, if a hysterectomy has taken place, then there's no need for the screening anymore. Osteoporosis screening. So women are at higher risk for osteoporosis at this age and should be screened regularly. If they were not screened before, we would establish a baseline at this age, and additional screening would be based on the results. Extra screenings for men, we continue with our prostate screenings, continue annually. Also, osteoporosis screening. If you have risk factors, again, for osteoporosis, you should check with your provider about screenings. And for male, risk factors are similar to those in female, includes long-term steroid use, low body weight, smoking, heavy alcohol use, or fracture after age 50, or family history of osteoporosis. Men aged 70 and over should consider getting bone mineral testing. And also for men, we may do an abdominal aortic aneurysm screening. And so if you're age 65 to 75 and have smoked, you should have an ultrasound to screen for abdominal aortic aneurysm. So what that is, we do an ultrasound to sort of look at the vessels in the abdomen. And it sort of checks to see if there's any like outpouching. It measures like the size. Your provider will document the size. If it's getting like, let's say it's expanding, it's getting bigger, they may want to decide to get it, send you to a specialist to get further evaluation. And just some additional information for cancer prevention. You want to avoid avoidance of tobacco. Become physically active, like getting at least 30 minutes of exercise daily, aerobic exercise daily for 5 days per week, as tolerated. but you always want to make sure you discuss with your doctor to just be sure that you can complete these physical activity, because we don't want you to injure yourself. So you want to just sort of see your primary care doctor, get a checkup, get evaluated, and then go from there. You want to maintain a healthy weight, making sure that you're eating a diet that's rich in fruits, vegetables, and whole grains, and low in saturated and trans fat. You want to limit your alcohol consumption. You also want to avoid excess sun exposure. Some other screenings that may also be recommended by your provider is for iron deficiency. And this can be done with the complete blood count that we discussed earlier, the thyroid panel to sort of check for if there's any thyroid disorder, and checking your vitamin D level. So if you live in an area like New York, New Jersey, then a lot of us are indoors, like in the winter time. So we don't get enough sun exposure. So our vitamin D level may be low. So this is something that you can ask your provider as part of your annual physical exam, if they can screen or perform a test to check your vitamin D level. So that sort of wraps up my presentation. I've provided my information below. I'm located at 6045 Kennedy Boulevard, Suite B. Our phone number and fax number is below. And I just sort of want to thank everyone that joined in for our presentation today.
All right, if anyone has any questions, now's the time to ask them. You can either put them in the chat box or in the Q&A. I'll be looking at both places. We did have one question come in from Maria during the presentation asking about risk factors. But Maria, I'm so sorry. I'm not sure which screening you were referring to. If you don't mind typing that in the chat box.
Yeah.
In the meantime, if anyone has any other questions, please feel free to put them in either the chat box or the Q&A, and I can ask them to Dr. Pert. And we'll just give them a minute or two to see if there's any
Yes,
questions. All right, so here's one question that came in. Do you recommend taking a multivitamin as a supplement?
So multivitamins, if you have a pretty healthy diet, you really do not have to take a multivitamin, but a multivitamin won't harm. So if you're not getting enough nutrition, then yes, you can definitely take your multivitamin.
Thank you, Dr. Pert. I've got another question. Actually, it's two questions. One is asking about the risk factors for a mammogram or the risk factors for a colonoscopy.
So for the mammogram, as I mentioned earlier, is that if you have, like, let's say you have a mother or a sister who has breast cancer at a young age, then you want to make sure that you discuss with your provider and get screened earlier. If you're someone who is overweight, you may be at a higher risk of breast cancer. If you're someone who is sedentary, means that you don't get any exercise at all. If you're someone who consumes a lot of alcohol, those could all be considered some risk factors for breast cancer. And also age. Age can also be considered a risk factor because we tend to see most breast cancers in older women. And what was the other question, Chelsea? I believe I sort of missed the other half of the question.
And for colonoscopy, the risk factors for colonoscopy.
Do you mean for like colon cancer?
Yes, I would assume so.
Yes.
Yes.
Okay. Okay. So a diet that's again a diet that's low in fiber, very low fiber diet. Someone who's smoking, also obesity can also be a risk factor. Family history. If you have a family history of colon cancer, that can also be a risk factor.
Thank you, Dr. Pert. And just to be sure that I addressed Maria's earlier question, would you mind briefly going over the risk factors again for some of the more popular tests that people need, screenings?
So we discussed so we talked about like diabetes because that's a big one. So in terms of diabetes, if you have high blood pressure, that's one of the risk factors. If you are overweight, if you have a family history, like a first degree relative who's also diabetic, and if you have certain conditions such as heart disease, kidney problems, those can also be considered. High cholesterol also can also be considered risk factors for diabetes. And then we talked about for like breast, if you have a family member, mother, sister, who has a breast cancer, if you've had actually other risk factors that I did not mention for breast is also someone who's never, we call it nulliparity, like they've never had like given birth or had any kids. That can also be one risk factor for breast cancer. If you're overweight, excessive alcohol consumption. Let's see if we're not missing, try not to miss any. And then for the colon cancer, if you smoke, if you diet that's very low in fiber, if you have relatives like a family history, let's say a sibling, a mother that also has colon cancer. Also, if you have certain inflammatory bowel diseases, that can also put you, at risk of colon cancer. And then was there a follow-up for that question?
There was a follow-up for the earlier question about multivitamins. I'm sorry, go ahead.
No. You can finish, sorry.
What other supplements are recommended other than multivitamins?
So you can take your multivitamins. If your vitamin D level is low, depending on how low it is, sometimes your doctor might give you a supplement, or they may just tell you to get like over-the-counter vitamin D. So for women, women can take calcium. Let's say if you're 60 or older or 50 or older, you can take also a calcium with a vitamin D. So for some of the patients who have like high cholesterol, sometimes your provider may recommend that you take an omega-3 fatty acid tablet or like a fish oil. But again, that's something before taking any supplements, I would actually discuss it with the provider, and then you and the provider make a decision before taking it. But multivitamin won't do any harm at all. Calcium and vitamin D for those that are a little bit concerned about like osteoporosis, that's a good one that you can also take.
I have another question. Thank you, Dr. Pert. Another question. What is the risk of radiation because of the tests?
So radiation for the mammogram, or?
Can we talk about all risks, I guess? They didn't really specify which test in particular.
So that one, I have to be honest, I don't know exactly in terms of the risk of radiation, but I know you will get some exposure to radiation, but I don't think it's more than the usual if you would have had a chest X-ray, or if you would have like maybe like a CT scan done.
Thank you.
But But
Sorry, go
I
ahead.
don't have, if for that person, I can do some research and find out exactly, but I don't have an exact answer for that question in terms of the risk of radiation.
Thank you, Dr. Pert. For
Yes.
the next question, in regards to breast cancer, how important is family history when compared to the other risk factors?
So family history is very important. And the reason is that if you've had a mother or a sister who had breast cancer at a younger age, then yes, we really want to screen you, get your mammograms a little bit earlier. And again, this should begin earlier than the age at which the youngest family member was diagnosed. And also, if you've had, like in your family, there's breast cancer, like mom, sister, aunt, we now have like genetic testing that can be done. So let's say you have a breast and ovarian cancer in your family. We have a test called a BRCA1 and 2 that we can sort of do to just sort of see in terms of like a risk of, breast cancer. And then from there, you can sort of discuss with your doctor and find out what would be the best next step for you. But not only for breast cancer, but in all conditions, I always say family history is very, very important. That's a very good question because it's extremely important to know what diseases or what conditions run in the family. So we can sort of focus on preventing those.
And as a follow-up question, do you recommend genetic testing in all cases where there's a family history?
Not necessarily in all cases. It depends. If it's a very close, like a first-degree relative, a mother, a sister, then yes, I would recommend talking to your provider about genetic testing. Some insurance does cover it, so I would definitely recommend talking to them about it. And especially if that family member got diagnosed at a young age, then I would recommend getting genetic testing.
Thank you, Dr. Pert. So I'm going to make the last call for questions. If anyone has any last questions that they want to make, you can go ahead and put them in the Q&A or the chat box at this time. And if there's no other questions, I want to say a big thank you, Dr. Pert, for coming out this evening. I want to say a big thank you also to our audience for spending time with us. And I do want to say thank you on behalf of both our director, Sai Rao, and the entire library staff, to Nikki Medeiros, to Hackensack Meridian Palisades Medical Center, and again to you, Dr. Pert, for
thank you very much
and coming out tonight.
Thank you, everyone, for tuning in.
Yes, thank you, everyone. Have a very good evening. Good
Bye.
night, everyone.
Thank you very much, Chelsea. Thank you very much, Dr.
Thank you.
Thank
Have a good night, everyone.
Yes, bye.